Dumelang, libitso ke Tebogo Moalusi. I am the Gauteng Provincial Convener for RISE Mzansi. Today we are at the Tambo Memorial Hospital in Ekurhuleni, and we are here because our people are crying about the health care that they receive, particularly the neonatal healthcare facilities. You know, when you are giving birth to a child, it's already a very difficult process, and the neonatal care facility is supposed to aid new mothers in getting healthcare support, especially for themselves and babies. In this facility behind me here, there are not sufficient facilities. There's no beds. Sometimes they run out of water. There's not enough doctors on site. The nurses are finding it extremely difficult to hold things together, and they're doing their ultimate best. This is a vocation that they love, but they for too long have operated without support, and it's completely unacceptable. You know, the people of Ekurhuleni called us and they said that this hospital, you know, it used to be something that they were proud of. Just like many others, Chris Hani Parakwanath is the same. All our hospitals are in trouble. All our hospitals are failing to provide healthcare to our people. But for the people of Ekurhuleni, because it is personal, in RISE Mzansi we speak about the politics of personal. This hospital for Ekurhuleni is important, and that's why we came here. But this is an example or the poster child of every other hospital that you find in South Africa, a public hospital facility. We have been told by people who don't want to be mentioned that the facilities inside are not up to standard. That's why we are here. Even if you stand outside, you can look, the infrastructure is completely dilapidated. And how do you come to a place like this to find healing? You know, you're supposed to come to a place that looks good, that has healthy spaces and has got professional service in order to heal, you know. But unfortunately, that's not what this place has to offer. So insofar as solutions are concerned, I think there's multiple approaches to look at it. We can't build new hospitals because this country is actually broke. We don't have money, and we've borrowed too much money from international spaces. And so we must fix this hospital. But we don't have to do it just as government alone. We can do it with private-public partnerships where we've got funding, but the businesses are not wanting to fund infrastructure like this because the government of the day is not reliable. There's too much uncertainty, even in the policy frameworks of how business can partner with the public sector to make places like this work. These are supposed to be public service facilities. This must be the first point of contact for our people. And also what we must do is invest in the clinics to make sure that the clinics can work, so that when people get referred to here, they already have got a first point of contact that they've engaged with, which has given them an opportunity to heal and solve their healthcare challenges. Safety and crime is one of the biggest issues we have in this country. You can't be safe at home. You can't be safe in your workplace. You can't even be safe at a hospital where you are coming and you're vulnerable and you're sick. As you guys know, there have been many incidents of crime in the parking lots, even sometimes in the hospitals. You know, you're lying in bed trying to heal and somebody comes and steals your cell phone, and all of a sudden you can't get in touch with your loved ones. And it's a rule of law problem. This government has lost its ability to own the center and be a leader in society, insofar as defining the moral code of how people are supposed to behave, you know. But over and above that, we should be making sure that public spaces and public infrastructure spaces like hospitals are safe for our people to come. You must make sure that there's policing around the perimeters. You must make sure that the security are vetted and that they have the skills and the resources to perform their functions. But most importantly, let's make citizens responsible for the safety of the people. That is a morality issue, and because the government of the day has failed to build the moral fiber of this country, you can't expect even the ordinary citizen and the community to even want to build a safe South Africa.